For physicians, the technology and the rate of information is just so fast that it's almost impossible to keep up. And so if people ask me, do you want to choose someone who's very technically competent and very up-to-date or someone who's compassionate, I say, I want both. Because if you're committed to the patient, you're going to read up on the latest technology and how you can provide that in a skilled way to the patient who needs it. You know, when you're a doctor, you touch people when they're hurting, and you have an audience that really needs hope and healing and good news, someone to care, someone to help them feel better. Anytime you touch a patient's life, it's sacred. Life is sacred.
Well, that's our own Dr. Becky Wong, and she's raising a very interesting point, the need for high-tech care and compassion. Do you see a special emphasis and a balance in this regard in Adventist healthcare?
I do, and I have a personal story about that because over the last couple of years I've had my own health issues, and I want to say that when you're a patient lying in that bed and you're looking up into the eyes of the physician, you want to believe that that person is up to date, totally up to date on the latest technology and can bring that benefit of that latest technology to you, but that they also see you as a human being and not just as a number, and they don't just see you as a chart, something, you know, on the chart. And so that was really important. And the second thing is, too, that in the last couple of years of her life, my mom was very ill. My mom and dad were living in Orlando, Florida, and many times, most of the times that she went in for care, she would go into Florida Hospital, the Adventist hospital in Orlando. And she told me many times that she was cared for and felt comforted by the care that she was getting, both, I think, from the best technology available, but also by the genuine care, everyone from the nurses to the technicians to the physicians that were there for her. And she said that to me many times. And I want to say that when it came time for me, her son, to go off and make a film about Seventh-day Adventists, I brought a lot of that appreciation that I had into the making of the film.
Were there any people in particular that really stood out to you?
Well, lots, that's easy to say, but I love the character of Ellsworth Wareham. And I had met him at a gathering, a social gathering at Loma Linda a number of years ago, and frankly, I didn't know who he was, other than the fact that I thought he was charming. And someone said to me, do you know how old he is? And I said, really, I don't. I thought maybe early 80s. And they said, no, he's about 95, in his mid-90s, and he still gets up every day and goes off and is involved in the operating room as a participating surgeon. He's assisting in the surgery.
Heart surgery, no less.
It's phenomenal when you think about it. Every time now we've shown the film in public, and people hear that at 95 he's still in the operating room, they just all gasp. And it's a wonderful testimony to not only Adventist lifestyle, but the idea that your longer life needs to be not only longer for you to enjoy, but the opportunity to be productive and to give back to the world, to live a quality life. That says so much, not only about his ability to live longer, but what he does with those extra years.
Well, are there any stories you wish you could have included, but you just didn't have time? They couldn't fit into the documentary?
Well, there are a lot, and in particular, we had looked at footage of some of the people that we had focused on, and particularly at Kettering, had gone off to Africa to do mission work. The mission component to the Adventist story is not in the film. And it's simply a matter of the amount of time that I was allocated in the making of the film. You know, public television is a 1-hour format, and that was it. And I regret that. I wish I could have had a chapter in the film, and maybe there's a whole other film to do about that very thing, which is how the church now is actually a larger church outside the U.S. It's an American-born religion, but it's larger outside the U.S. than it is here.
That's true.
It's about 15 million people outside the U.S. and 1 million people here in the U.S. And the work, the hospital work, the healthcare work that's being done outside the United States is really remarkable. And maybe there's a second film here.
Now, historical reenactments are very prominent in your production of The Adventists.
The 1860s and the Civil War was raging. And it was a time when medicine was still in the Dark Ages.
There was no concept of a germ theory yet. A hospital is a place you went to die.
A young woman, Ellen White, had a vision, she claimed from God, for a new understanding of health and healing. It became one of the cornerstones for a new American-born religion, the Seventh-day Adventists.
What was it about the historical roots of the Adventist Church way back in the 1840s that caught your attention?
I wanted the film to have a connection, to show the connection between what's happening on a contemporary level for the church today in its healthcare ministry. that it's not disassociated with its own history. And that from the middle of the 1800s, the Adventist Church was clear that it wanted to go down this route. The way the church evolved out of that moment called the Great Disappointment, characters like John Harvey Kellogg, all of this, I think, and Ellen White, of course, is the center of all of this. And I wanted an opportunity to tell that story in such a way that it would give the viewer the imagination, give them something to feed the imagination that would say, I understand where these people are coming from and why they have the commitment to do what they do. But to tell that story, you have to be careful. I mean, Ellen White's story raises controversy. It does for a lot of people. It seems to others that it's a little strange that she would be a woman of visions. How do you visually depict that? I mean, you have to find the line in how to really depict that, because people who will be watching this will be people who believe that absolutely those visions came from God. Others will be highly skeptical of it. So you want to do it with enough latitude so that people on both sides can feel as though you've treated it with integrity.
She would often faint on the floor. They'd put a pillow under her head, and she would be seemingly out of it. They would test, and they couldn't see that she was breathing. And then she would come out of these and start saying what she had seen.
In 1863, she had what is known in my circles as the comprehensive health vision that outlined a deeper commitment and to bodily health and an understanding of the close relationship between bodily health and spiritual wholeness.
Now, what do you see as the connection between community and health?
Well, I think the fundamental message that the Adventists want to get out there, and I think in some ways the film talks about that, is that health care is not simply about the critical moment when you come into a hospital and you're already beyond where you need to be. You're already sick and vulnerable and weak by whatever health condition you have. But if you really do see the body as the temple of God, that aspect of prevention, care of the body, is at the heart of the Adventist message. And I think it's a fundamental message for all of us.
And what do you see as your hopes for this documentary going forward in the future?
Well, I hope people enjoy watching the film as much as I enjoyed making the film. I enjoyed learning more about Seventh-day Adventism, its role in American history, and what it actually has to contribute now to this ongoing debate about health care. I've changed my own life.
I was just going to ask you, have you changed any of your habits?
Well, with each one of these films, Lonnie, you have to believe, as I do, that you're sort of sent in that direction at this particular time. You're led here to maybe begin to think differently about certain topics. And in this particular case, I'm 58, and I'm taking my health really seriously. No, not that I didn't before. I mean, I don't smoke, I don't drink, but I'm really more focused on the idea of the body as the temple of God. I really have bought into that whole idea. Thinking like that is not just self-preservation, but it's honoring the gift that's been given to me. And that really does shape, there's a line in the film from Charles Scriven, who says it really does have a revolutionary effect on the way that you treat yourself when you get up in the morning. And I'm starting to let some of that rub off on me. I think that's a really important thing to do.
Now, how can our viewers see this film?
It'll be airing nationally on public television. It begins in April of 2010, and it'll air on public television for the next 2 years. And we hope there'll be hundreds and hundreds of airings of the film, so that maybe we hope that anywhere between 30 and 40 million people will have a chance over the next 2 years to see the film. And we have the film on DVD, and both the information about the film, where it's airing on PBS stations, and the DVD's availability is all on our website.
Oh, give us that website information.
It's www.journeyfilms.com, JOURNEYFILMS.com. It's both about the fact that we do travel a lot to make these films, but it's also really about the spiritual, the inner journey that happens for all of us.
And someone could even order a copy of a DVD.
Absolutely.
Martin Doblmeier, thank you so much in your busy schedule as a film producer for joining us today on Healing Hope.